Possible cuts to Medicaid has the Genesee Health System worried. A large chunk of its funding comes through the program, and it believes cuts could turn deadly.
TV5's Zane Omer shares how this could affect patients and what solution the public health care provider is looking into. Zane.
Genesee Health System sees about 15,000 patients every year, offering services for things like substance abuse, developmental disabilities, and primary care.
People's lives will be in danger. And I know that sounds pretty dramatic, but we think that is a very real outcome if these cuts go the way that they are talking.
Genesee Health System is the public provider for mental health services in Genesee County.
These services literally keep people alive in the most extreme cases. A lot of other cases, they make people's lives better, they add dignity.
But CEO Dan Russell says many of those services could go away if U.S. lawmakers pass proposed cuts to Medicaid.
Our Medicaid budget's about 90 to 95% of our funding. We get other kinds of funding, but it is a very small percentage of our overall budget. So any kind of cut is going to be difficult. The kind of cuts they're talking about to get to the budget number that the administration has targeted would be devastating.
If passed, the bill would cut at least $880 billion to Medicaid in an effort to get rid of what supporters have said is waste, fraud, and abuse to generate savings. But Russell disagrees with the way to save money.
If they were to do a methodical approach and look for that fraud, waste, and abuse, I think everybody in the field would say, yeah, that probably needs to be done. But just to take the chainsaw and just start cutting without knowing what you're cutting is a very dangerous and just really irresponsible.
And Russell says this won't just impact a few programs in a few areas.
It wouldn't just be that there would be a delay or a wait for services, there would just be no services. And everybody who provides those services will be in the same situation, so it's not like we can send them somewhere. The hospitals rely heavily on Medicaid, federally qualified health centers. At the worst extreme, the hospital emergency rooms and law enforcement will get overwhelmed with individuals because there just won't be any place else for them to go.
As the bill plays out in the U.S. House, Russell says he's been in touch with local, state, and federal leaders to figure out possible next steps.
Pretty much the consensus is, since we don't know and since there is so much variable, everybody just kind of, we have to take it day by day and keep doing what we're doing. Hope our lobbyists and legislators are listening.
Russell says roughly 100,000 residents in Genesee County are enrolled in Medicaid, making it the fourth largest county for Medicaid in the state of Michigan.